Good morning, Lake Providence Church family and friends. This is Dr. Linda Plummer Ward with another health ministry update. Good to see you today. We're going to talk a little bit about vaccines again. So, how were these vaccines produced so quickly when it usually takes years? Well, we were already familiar with the coronavirus family of viruses prior to this one because of epidemics we've had in the past and because it's one that circulates and causes upper respiratory infections. Secondly, the genetic code of the SARS-CoV-2, which is the virus that causes COVID-19, was published by the Chinese researchers in January of 2020. That was so that all scientists all over the world could use it in research. Third, work with the mRNA vaccine technology was already in progress for HIV. We'll talk more about mRNA and that technology next week. Just know that it's the vehicle or the vector to get us to make antibodies against the virus. Fourth, within a week after Chinese researchers published the genetic sequence, scientists at the University of Pennsylvania were able to develop a synthetic mRNA against SARS-CoV-2. Next, Pfizer and Moderna both got licensed quickly to use this discovery for vaccine development. Next, both public and private sectors offered financing and funding for this research in an unprecedented manner due to the tremendous sickness and death from this pandemic. Next, the 3 phases required in clinical trials that test vaccines were accelerated. The phases overlapped each other rather than going sequentially, where you would finish one and then start another. They were going at the same time. And lastly, mass production began even before the clinical trials were completed. Now, are these vaccines safe? Well, let me give you a few pointers so that you can make a decision along with your doctor. While mass vaccination is desirable to stop the spread of this disease and get back to some sense of normalcy sooner, this will be an individual decision that we'll all have to make. The vaccines were tested in tens of thousands and will be millions before it's over with. The FDA deemed Pfizer's vaccine to be safe 2 days ago and granted emergency use authorization. Now, the 2 vaccines do not contain weakened or dead SARS-CoV-2 virus, as vaccines in the past have. That's the new technology. It does not contain virus. The vaccines contain the synthetic mRNA protein. It contains protein from the spikes on the outside of the virus that's also synthetic. And a lipid or fatty coating that goes around the messenger RNA to make it easier for it to get into our cells once we're injected. Several committees and advisory boards selected by the FDA and the CDC that are not associated with the government review the vaccine's clinical trials before it is deemed safe. To date, both vaccines required 2 injections, an initial shot and a booster 3 to 4 weeks later. We know that some people get arm soreness with the first shot, and the second shot produces inflammation in some people that lasts 24 to 48 hours and has soreness of the arm, fever, maybe chills, maybe body aches. And those symptoms are reportedly relieved by Tylenol. Some people with a history of allergic reactions have had to use their EpiPen because they've had allergic reactions after taking the vaccine. Other symptoms are reportedly rare. The vaccines have not been tested for safety in children under 12 or in pregnant or nursing mothers. So what should we expect now? The vaccines are both unstable unless they are stored at a temperature sub-zero temperature. Pfizer's vaccine has to be less than negative 94 degrees Fahrenheit, and Moderna's has to be a negative 25 degrees Fahrenheit. That's below zero. The first and second shots have to be the same vaccine. You can't do a Pfizer and then do a Moderna for the second shot. It has to be the same company. Distribution will start with first responders, followed by the nursing home residents. Healthy individuals will not be expected to be vaccinated until mid-2021. So mask, social distancing, hand washing, that whole protocol, that will continue at least through 2021. The vaccine is expected to stop severe disease, reduce hospitalizations, and reduce the death rate. We don't know yet if it will be able to prevent transmission from asymptomatic or symptomatic people to those who don't have an infection. It is not known how long immunity will last. And those who have tested positive, whether they were asymptomatic or not, are asked to take the vaccine because the amount of antibodies and the immune response that's produced by the vaccine is much greater than that produced by our bodies when exposed to COVID-19. Hopefully, the states will determine distribution plans for U.S. citizens, because that plan will come from each state rather than from the federal government. The UK approved the vaccine and gave its first vaccination to a 90-year-old on December 6th. How will we know if it's effective? The aim of the vaccine is to achieve herd immunity, as we discussed last week. About 70% of us have to have immunity for that to be achieved. And we'll know because the curve will flatten and the transmission rate, the percent of people testing who test positive, the rate of hospitalizations, and the death rate should all decrease. Join me next week when we talk about messenger RNA and how the vaccines actually work. Thank you for joining me today. As always, stay safe, stay healthy, and stay prayed up.